Welcome to the Elaborate Topics podcast, where we focus on lab-specific strategies for medical laboratory professionals. We're proud to be the healthcare detectives that work behind the scenes to get the results needed to influence medical decisions. Let's grow together and jump right into the lab.
Welcome to another episode of Elaborate Topics. I am your laboratory mentor and co-host for this episode, Tywauna Wilson. If this is your first time checking out the show, welcome. Thank you for listening. Elaborate Topics is a weekly podcast where myself and my co-hosts, Lona Small and Stephanie Whitehead, bring you relevant leadership and technical strategies happening inside and outside of the lab. Please do us a favor and share this show with your friends and colleagues, and don't forget to join our Elaborate Topics community on LinkedIn. I am very excited about my guest today. I brought y'all somebody that y'all really need to hear, and I'm so excited to bring her here to share her story and share her journey. So Dr. Nicole Jackson is a graduate of Duke University and Tulane University's School of Medicine and Public Health. Dr. Jackson completed her anatomic and clinical pathology training at Louisiana State University Health Sciences Center and her forensic pathology fellowship training at the prestigious New Mexico Office of the Medical Investigator. She is currently an assistant medical examiner for Cook County in Chicago, Illinois. Her interests include clinical and medico-legal autopsy, medical education, mentoring, community outreach, wellness, quality improvement, increasing the visibility of forensic pathologists as first responders to threats on our nation's life expectancy, and using population-based data to reduce the number of preventable deaths. Dr. Jackson, hey, how are you?
Good. Thank you for having me. I'm excited to be here.
I am excited to talk with you and hear more about your journey. So let's just jump right in. Can you tell the listeners a little bit about your career journey and how did you get to where you are today in your role as a medical examiner?
Sure. So like many things in life, things don't go exactly how we plan. So initially, back in high school, I was interested in psychology of all things. But I was invited by our local medical school to attend a mini medical school program, and I just became fascinated with the human body because they allowed us to interact with organs from different donated specimens. And so from there, I actually was drawn into general surgery, and so I went into med school with that mentality. I actually started my training as a general surgery resident in North Carolina, but not too far in, I just realized that the culture wasn't for me. The career, it wasn't really in line with what I had envisioned my career to be, who I envisioned myself as an individual to be. And so I did some reflecting, and I realized all the things I loved most in medical school were the lab, pathology, if you will. Everything from biology, histology. And so I made the switch into pathology from general surgery, and I actually switched specifically to do forensic pathology. I lost my father at a young age. He died suddenly, and it's something that stuck with me. And so when I was evaluating career options, I tend to get bored easily, but I knew something I would never get bored of was being able to provide closure to families and tell them how a loved one died. A lot of times people don't know the people that come to us. A lot of them are natural deaths, people that die at home, infants that die suddenly, and we are able to provide information that helps the family in their grieving process and to provide closure. I love forensic pathology as well because it's a really good interface with public health. We're really on the front lines, behind the scene, but on the front lines of what is threatening our life expectancy. So whether that's gun violence, whether that's drug overdoses, whether that's a new infection like COVID, we're some of the first people to see those trends within our community and to report those to the public health department, to different researchers who then generate different targeted interventions to hopefully help our community. So those are some of the reasons I made the change, and I've been very happy with that change.
Wow. That's awesome, and that's very interesting. And so for the listeners out there, how many years of school was that for you?
It was a bunch. So 4 years of undergrad. During undergrad, I kind of waffled between whether I wanted to do psychology or go to medical school. So I actually wound up doing an additional year as a post-bac to do all my pre-med rec. So that's 5. Then 4 years of medical school. I was fortunate enough to do a combined MD MPH program, and so I earned my master's in public health and epidemiology in the same 4-year time frame. I earned my medical degree. So that's another 4, so we're up to 9. I did a 1-year internship for general surgery. That's 10. 4 for a combined anatomic and clinical pathology residency. That's 14. And then I just finished my fellowship, which was a year. So that's 15 years of schooling, which is a lot.
Wow. That is a lot.
A lot when you're sitting in your 30s.
It is, and I asked that question because sometimes when people hear about pathologists, they don't understand how much schooling you all have to go to for your specialty. And so I just wanted to make sure that the listeners were aware that you all are very specialized and go through a lot of education and training to do what you do. So thank you. Thank you.
The type of person I think that is drawn to pathology is also the type of person that really likes learning and likes book learning, and so I think it kind of feeds itself. It was long, but it was enjoyable,
Awesome. And you could tell it really sounds like you enjoy what you do. So, Dr. Jackson, when most people think of a medical examiner, they think of CSI, they think of glamour, they think of what they see on TV because for some people that may be the only exposure that they have. So how does that actually compare to what you actually do in your role?
So I'm probably one of the few in the field that has never watched like CSI or any of those crime shows, but I have had this discussion with many of my peers. I think there are a lot of differences. One, we are fully gowned in PPE. That includes usually, things have changed a little with COVID, but usually it's a long gown, like a surgical gown that they would wear in the OR. You have 2 pairs of gloves on. You have these covers that go over your boots. You have eye protection and usually something over your head. So you are fully gowned just like a surgeon is. The difference is you don't have to worry about contamination because there's no potential risk of infecting the dead body. So that's one thing. Another thing, I think a lot of times on those shows, they just turn around results very fast. So they'll look at a body and say, oh, this body has been dead for X number of time. We don't do that. It's a very inexact estimate you can give, and it's influenced by a lot of variables. So it's going to depend on how hot or cold it is. Was there an underlying infection in the person? Were they recently exercising? There are a lot of variables that play in. So we can't actually just look at a body and say, they died 10 hours ago. That's not real. And then the amount of time it takes to generate these reports, the final cause of death determination can take, sometimes it can be done right there, but usually it takes on the order of weeks, if not months, because usually there's a large coordinated effort. So part of our autopsy examination, we usually image the body, whether that's by X-ray, radiography, or by CT scans. depending on your office and your comfort level. Then you perform the autopsy, and that could be anything from just an external inspection, so a lot of people that die in motor vehicle collisions where there's obvious lethal head trauma, skull fractures. We don't do a full post where we dissect the organs because we know what killed them. However, for a lot of cases, I'll say, we do a full autopsy, which includes weighing and inspecting every single organ, major organ, so the brain, heart, lungs, kidney, liver, spleen. We weigh them. We look for any abnormalities. And then, depending on the case, you might or might not perform histology, where you actually take sections of those tissues and put them in a cassette, which then goes to the lab, and they create slides. That's multiple days to turn that process around. We also draw for toxicology because a lot of our cases do involve intoxications, whether that's alcohol, cocaine, heroin. A lot of drug overdose deaths come to us. So with those, we collect either urine and or blood, and we send that off to a national lab. And that turnaround is on the order of weeks. And there's some other studies depending on the case. Sometimes we have to consult other specialties, so neuropathology, and then they do their own exams. Sometimes a cardiac pathologist will analyze the heart, especially in younger people who die. And so that's taking weeks. And so it takes weeks to follow up also with the police and their reports, or the fire department and their reports, to make sure, this was an accidental fire and no one intentionally set it, because that determines if it's an accidental death versus a homicide. So it takes weeks to generate these reports, and at the same time you're juggling or handling multiple cases. So the turnaround time is a lot longer than what's presented on TV. That's probably one of the biggest differences.
Thank you for sharing that. That's good, because I know it happens a lot where people say, well, they did an autopsy and we still don't know anything yet, and it's been like a few days. And then well, when are we going to find something out? So thanks for going through the complexity of everything that goes into it, and that it could be months before a family may find out anything.
Absolutely.
So you mentioned earlier about COVID-19 and the world as we are today, and the medical lab team has been pushed to their limits during this COVID-19 crisis. I know our team here in Dayton, Ohio, we had one of the first drive-through COVID testing, and working long hours. I mean, just here around the clock, doing all of the testing. What suggestions do you have for ways that medical lab professionals can preserve their health and keep their own self-care top of mind as we are trying to do the best that we can for our patients and our communities, but sometimes we are just exhausted?
Yeah, absolutely. This has been, as you said, a trying time for everyone, but especially anyone in any type of laboratory setting, whether that's the clinical lab, running all those tests and analyses, or us over in the autopsy suite performing, record number of cases. Everyone's just been pushed to their max, both within our field and other fields. So one of the things I've really tried to push in my own life is forcing myself to stop, because you just get caught up in this go, go, go mentality. And you wind up bringing things from work home, whether you live with someone or not. I like having my home space be a sacred space where I'm not bringing in things from work home, where I'm not bringing that energy into my interactions with other people. So there are a few things I've done. Personally, I am religious. I'm a Christian, and so I've been reading my Bible more, which really helps center me. I've also downloaded quite a few apps that have helped me carve out space and time in my day for meditation, just to get water. One of the apps I like is called Fabulous. These are all free. And you can structure your day to have these reminders to stop and go for a 5-minute walk, to stop and get a cup of water or coffee or tea or what have you, to stop and stretch. And I really think these pauses throughout the day are necessary because otherwise we just exhaust ourselves. Another thing I've tried to do is incorporate a regular schedule of exercise. It's far easier in the summer. As you know, we're in the Midwest winter already. But even still, I invested in a home rower that folds up so it doesn't take a lot of space and then folds out. And they have a lot of programs in just making that a priority. And it really helps with stress, physical exercise. And one more thing I was going to say. Just slipped my mind. But those are the biggest things. But it's something you have to make a priority, or it's never just going to present itself because time is such a limited resource right now.
Absolutely. Self-care is always a good thing, and it's always important. As they say, put your mask on first. If not, you're not going to be of value for anybody else. So those are valuable tips.
And I do have one more thing I wanted to add. Sorry for the self-care. A lot of people, I think, reduce self-care sometimes to, taking a bath, which is good, or even exercise, which is good. But I think a large part of self-care is having a reflective process where you actually take the time to reflect and think about what you've been through and your actions and how you are doing. Because the other self-care that I think is promoted a lot, it's very superficial, and I don't think it helps us in the long term with burnout and things like that.
Absolutely. I agree. Has your team been getting a lot of I don't want to say flack, but, with COVID-19 and everybody kind of being in a mental place right now when they feel like their loved ones are passing and they feel like every time somebody passed, they're saying, well, it was COVID. It was because of COVID that they passed. How's your team kind of dealing with that pressure that I don't know if it's put on you all side necessarily fairly or not?
I will say my interactions have actually been overwhelmingly positive. Everyone that's called in asking, as you referred to before, some people think these reports will be out on the order of days, and they're not. Everybody has been very sympathetic and supportive of us, calling in saying, I know you all are going through so much. I just want to know this. And everyone I've interacted with has actually been very kind from the family and very understanding. Most people just want to know what happened. And so when you walk them through your process and why you order what tests you do and why you don't order some, as long as you communicate, everyone has been actually very reasonable.
Mm-hmm. Good. That's awesome. That's great to hear. What skills and strengths do you feel are important to be successful in your role and to be a leader in your industry as you're working with other up-and-coming pathologists?
So one of the strengths or skills I've had that I think is important just in laboratory medicine and pathology is organization and attention to detail, especially now we've been in this pandemic for nearly a year. We're all working at record number of cases. Going in with your own system to stay organized and on top of your work, I think that's paid dividends for me personally. When I look at some of my friends in some other offices that aren't organized, it just adds an unnecessary level of stress, I believe, when you're not organized and you don't know where your cases are or what you need to follow up on. That just adds stress and anxiety, which then negatively harms you as an individual, you as a team player, you as someone that's potentially a leader in your field. So I think that is first and foremost the important. As far as being a leader in my industry, I don't know if I'm there yet. I just started. I just finished my fellowship in June. I think when I look at myself as a future leader in the industry, I think it's important to hone in on what your specific calling is and not trying to follow what you think a leader should be or what you think you should be, but, what are you called to do? And that will set you apart because you will be doing that naturally and with, genuinely and with your heart. So for me, things that are very important to me in my career are mentoring. I would like to, over the next few years, I would like to develop a program with our office doing community outreach to the youth and somehow bringing them into the office for different presentations, different engagements. And I think, no one else is really, to my knowledge, in this field thinking in that capacity, how to engage the community. And I think it's a very natural role we should have. But people are pressed for time. It's not there any interest. And then something else I like is research and researching things that are interest of me. So epidemiology, disparities. I don't see a ton of that. So I think simply by doing these things that I'm interested, that I'm called to, and also it seems like few other are, that will set me apart as, I guess, a leader.
Right. We definitely need it. Mentoring is critical. Mentoring allows access. It allows others to be able to shorten their learning curve. I know for me, if it wasn't for the many mentors that I've had over the years, I know I wouldn't be where I am today. So have you had mentors or coaches on your path thus far?
I've had only a few.
Mm-hmm.
So back in medical school, when I was very gung-ho general surgery, I had two general surgeons that were mentors to me. One was more of an academic research mentor, so he pulled me into his research projects. He was excited to have me because I had the public health background, and then he helped fill in a lot of the gaps and paired me with another public health professional who really taught me a lot, just how to structure research papers, how to efficiently conduct different research projects. So that was instrumental. And then the other was a lovely, she was a black female surgeon that not only was a research mentor, but just she tried to help me with constructing my application for the process, which, I didn't have anyone in my family in medicine. So I was going into everything blind. So it was just nice to have someone to be a soundboard for your different concerns, for your different worries, and whether you should actually give any energy to some of these things that come across your mind. I won't say I had any in residency, but then fellowship was a very, very positive experience, and I would call all of my attendings there mentors. Like everyone I felt went out of their way to make sure we were all doing okay, both personally but also our career paths, which was great.
That's awesome that you had some mentors in the field. One of the things, I've had many mentors, but I have had very few that's actually been in the field of laboratory medicine. I could count on my hand how many mentors I've had in this field. That's one thing I feel like that I kind of missed out on. I had one mentor that was a laboratorian, and I've been able to be a mentor to other lab people. But do you find that was valuable to have a discipline-specific mentor, so somebody that's in your career, in your niche, or not?
Oh, absolutely. I think it's great to have anyone in your corner that is looking out for you. And, we are complex individuals, so that person can be a mentor just in general professional development and interaction, but there's always a benefit if you can find someone in your specialty that knows how to navigate these specific challenges and obstacles that will arise inevitably in that field. That's priceless because, even within pathology, I don't know the specific struggles somebody that's more in academic general pathology has. I have no idea, just like they have no idea our day-to-day struggles. So the more specific you can get with a mentor that better aligns with exactly what you're doing, the better. So even within forensics, I now have someone I consider a big sister within my office, and, because she knows all the dynamics of all the personalities and, things that have been going on in that office for the past 5 years. People, to kind of watch out for, people you can trust openly, and you can't get that elsewhere. So.
I absolutely agree with that. That's why I asked that question. And so many laboratorians don't necessarily have mentors in the field that can help them, especially navigating workplace politics and corporate politics and, different things that they should know, the unspoken rules that occur after you get into the workplace that you don't even touch on while you're in school. So mentorship is valuable, absolutely. So I'm excited to hear that you will be thinking about starting a mentoring program because it's needed. And I'm sure that people in your community just being able to see someone that looks like them in a position that you are in for the youth would be great. So that's awesome. So, Dr. Jackson, we have all failed at one time or another, and I know we talked about your educational journey and the many, many years that you've spent in school and your achievements, but I'm sure along the way there has been some failure. So we can't talk about success and leave out failure. As you know, when you're working with our children, when they see us, they think that we've always had success or we've always had a good life or we've always made it. And so it's important for them to know that, yes, with the success came failure. Can you tell us about one of your failures or learning lessons that you had, and what was it that you gained from it?
Yes, there are a ton of failures in everyone's life, or I guess, I don't know, I read some quote, there's, it's like I don't fail, I either succeed or learn, right? So, and I think that mentality is very important. To me, a failure would be not learning from an experience that didn't go your way or how you anticipated it. That's, to me, a failure, because everything should be about growth and making yourself a better person. And sometimes I think successes can be worse because people can get caught up on a success and fail to progress and fail to grow and become stagnant in their growth. And I think when you become stagnant, that promotes, death of development and death of part of your potential. But back to your original question, a failure. So there really are so many, and looking back, and I would encourage anyone coming up along to keep a journal. I wish people told me to, and I didn't, but it's hard to recall everything. But one of the moments I felt honestly like a failure. I wasn't, but I felt like a failure, and I was very depressed and sad about it, was that general surgery intern year where I thought I dedicated my whole life to this goal, and here I was, and I was so miserable, and I really didn't know how to get out of it. I thought, how could I be so wrong on something I spent so much time dedicated to, and it hurt deeply. I was depressed for a while. I was blessed enough to have a program director that was supportive of helping me find someplace I could be happy. which is rare because unfortunately, the structure of the medical training system a lot of times doesn't encourage people to move between specialties or between programs, because that's then a spot they have to fill. But I was blessed to have him in my life, and what I wound up doing between all the long hours, taking time to sit and reflect on what in medicine really made me happy, why I was in medicine to begin with, what drew me there, and what I really envisioned my future. And I think that's the first time I sat and really did that. I think initially I was drawn to surgery for a superficial reason, the instant gratification of fixing things with your hands. But I think my exposure in med school was not reflective of a lot of programs in the U.S., and so I went from what was a small program to a huge program where it just dominated your life, and I wasn't prepared for that jump. But, that whole experience is why I really made it a key point in my life to pause a lot and take time when I need to make any decision, and to really think and reflect and pray and not rush anything. And that has served me well with so many other decisions I've had to make going forward, and avoiding kind of going down the wrong path.
That's good. That's good. Reflection is always good, to see where you are and know where you came from, and to know and see your growth as you move forward. So that's awesome. So when you think about the flip side of failure, and we talked about the academic achievement, what has success taught you, like success overall? Because for some people it means something different depending on your communities. For some people, success is graduating high school. Some people, success is still being alive past the age of 18. Success could be different depending on the viewer. So what has success taught you?
So that's funny, because I don't even consider myself successful yet. I know, on paper it looks like I've done a lot, and surely I've sacrificed a lot, and I do think part of success is sacrifice, some element of delayed gratification. But success to me, one day we will all die. What do I want to be remembered for? I don't think I've reached that yet. So for me, success for me in my life and my career, they're intertwined for me, is using my career to benefit my community, the Black community in America. And there's just so much work to be done, and I don't think I have, because of being in training for so long, have been able to contribute as much as I would have liked to. So that's why I have plans for my career that has just started. That includes community outreach. It includes research on disparities. It includes addressing, the many issues in the medical community and medical school admissions that have really kept us back for, literally decades. We've heard so much talk in the medical field about the necessity for diversity and inclusion. I just did a study, and we reflected, and, over the past 25 years of all this effort, underrepresented minorities, that's Black, Latino, Indigenous people, they are still underrepresented at the same rate they have been, for decades. So what are we really doing? So to me, I won't be successful till I address some of those things.
Absolutely. Well, thank you for your willingness to even want to address some of those issues and talk about it and bring it to the forefront.
I have to. It's my calling. Sorry. That's something that's like I have to. Somebody has to,
That they do. You're absolutely right. You are right. So what are some of the things that us in the medical lab community and really the community as a whole, what are some of the things that we can do to help in some of these areas? people are always looking for ways to help. So what are some of the things that people can do?
To help specifically what I just said?
Yeah.
That's a good question. And, yes, people do want to help. I'm trying to think of a tangible way to achieve that goal. I think podcasts like this are an excellent starting point. I think a lot of answers lie in collaboration. Mm-hmm. I think one benefit of, this pandemic, there have been, at least in my life and a few other people, I've seen this recurring trend of people being able to form these interactions and relationships across distances that they didn't before, because now people are using social media and different technologies to reach out and connect. And so I think the more we connect with different people, with different perspectives, the more we can collaborate and think outside the box for ways to combat this, because the thinking inside the box basically failed us for decades. So I don't know. I'm kind of rambling here because I don't know the answer, but I do think just bringing it out there, somehow bringing like-minded people together is step one.
Mm-hmm. No, I think that's good. I think it starts with that awareness, and it starts with advocacy. It starts with podcasts like this one. It starts with discussion groups. It starts with bringing diverse personalities and cultures and attitudes and skill sets and educational backgrounds and different people together to even have the conversation. I think with the pandemic, you are right. It forced us to start talking. I mean, before, everybody was just on the go. Move, do, and we were all in our own space doing our own thing. And with the pandemic and the world shut down, we actually had to stop and take a pause. And I think it really started to open up the channels for communication. And I think, there's no simple answer to that question. I think we just build on what we have started. So it took a pandemic for us to start talking.
Yeah, I agree with everything you said, and I really hope this momentum carries forward. People, I don't think we're going to go back ever quite to how things were, and I think that's for a good thing, but I do hope there's some things we carry forward. I do think it's the reaching out and connecting, and I do hope it's the pausing and having intimate discussions.
Absolutely. And you mentioned social media, and I take it that you're active on social media. So how are you able to utilize the social media, whichever platform or platforms that you're on, to help yourself grow and to help grow as far as your profession and getting the word out on some of these things? How are you been able to utilize social media in a positive way?
So I was hesitant to engage professionally on social media outside of LinkedIn, which I do use LinkedIn. It's almost more of just a portfolio of almost a live CV of what I've done. But sometimes I do post some articles I think are relevant. But just with the nature of this profession, I've heard from a lot of people who are a little more advanced in the field that were very wary of doing anything on social media because they were always afraid, some lawyer might search for something, or I don't know. But I also think that's a generation that's less comfortable with social media. And then I was invited to attend the Association of Pathology Chairs annual meeting as a resident. And they encouraged the small group they chose to delve into Twitter professionally. And there is a large network of people that are using it professionally to reach out to mentor, to reach out to teach, to collaborate on different efforts. And I've really grown on there, and I actually like it a lot. I've had multiple people reach out that want to do podcasts And that's one way I speak. And then I always say, if anybody's interested in the field or asking me any questions, here's my Twitter handle. And every single time I've gotten someone that's either a med student, pre-med, or resident reach out to me, and I've been able to serve a mentoring role for them and answer their questions and help them get through this process that, unless you come from a family of physicians, you have no idea, how you should navigate this system. So I've really actually enjoyed it. And it started with me just being within the pathology and laboratory medicine Twitter community, but it's branched out to, I have some of my quote-unquote closest connections on Twitter are, some people that are in general surgery, some people that are in psychiatry, some people that are in emergency medicine. And it's really been interesting during COVID watching people express their different struggles and realizing your struggle isn't, that unique, which is somewhat comforting. And people have been there to comfort each other. I hope in this year to introduce a little more teaching and scan some slides that I have saved just to add to the fund of knowledge for those coming up behind me. But it's been, I found it to be more positive than negative. I think you have to be strategic and stray away from different topics. But by and large, it has been a real boon to my personal development and my professional development.
Awesome. Yeah, I'm happy that you mentioned that because I actually got connected with you via Twitter. So
I know.
it's because you post about lab-related stuff, and we have some common connections with other pathologists. And so I think it's a good way to bring people together, again, utilizing it for productive means, of course. And so listener audience, if you are not on social media, that people are out there. So if you are looking for a mentor, if you're looking for some information in regards to your industry or personal growth or professional growth, there are experts that are out there, and they are out there giving valuable tidbits of information that you can find. You just have to plug in and get connected with them. So if you're not on Twitter, maybe that's one that you can try. You have to get on there and try it. I'm on there. I can't say I'm the best Twitter person, but I am on there, at least in the conversation. And so that was one that you definitely want to get connected in. So, Dr. Jackson, what has been the most impactful moment of your laboratory career?
Most impactful moment? I don't know if I have one specific. I think there was one case I had back when I was a resident doing autopsies, hospital-based service. And it was a case, unfortunately, it was a younger black female who had died. The short version of the story, she wound up dying. She didn't know she had AIDS that she acquired from her husband who, was running around. But it was the first time, because so many of what we see, I think, aren't you don't see that many women compared to men. Most of it's mostly men. But that was the first patient or decedent I looked at and, saw some reflection of myself and the community and different struggles. And that was the first case where it's like, I need to be there for this community. And that was the first case I was like, I need to do forensics. I have to do this.
Wow.
It was just one of those. The whole story was just sad. Like, she went and sought medical care for her symptoms, but it was at one of the poorer, less resource-invested hospitals in the area, which, of course, was in the black community. And, it triggered just all these questions in me. Had she sought care, been able to seek care somewhere else, would she have been alive? Probably, because she would have, had the correct diagnosis. But, of course, she was poor and Black and lived in this neighborhood with limited resources. And it just, it really infuriated me and made me really want to, one, get the diagnosis right at autopsy to provide that information, but two, also just be in the system, because so much of what we do as forensic pathologists is really speak for the dead and for what happened in their lives. And hopefully by, sharing that information, we can inform the living and change things. So that was the case that really got me revved up, and equally kind of annoyed and infuriated at the medical system in America, but also very eager to be a part of the potential change.
That's awesome. Definitely need more people like you with that passion to represent and speak for those that are no longer here. Being able to tell the story for the families, for that closure, is very important. So what tidbit of wisdom would you give to our listener audience that they could use in both their personal and professional life to grow and be better?
Let's see. It probably sounds like a broken record, but I really think the more you are centered as an individual, so figuring out what it is that centers you, that is how you're going to be the best professional version of yourself. I think it's one thing I've seen over and over again, so much, we all train so much, we learn so much science and whatever for technology, but so much at the end of the day, it's just people and relationships and learning how to navigate different people and different personalities. And if you can do that, that will get you far.
Absolutely. I agree. Being a person who is able to assess people and situations is critical.
Mm-hmm.
So how can the listeners stay connected with you and continue to follow you on your journey?
So I think that the best way would be for just my professional development to see, what I'm publishing, different articles I think are relevant and important to not only pathology or laboratory medicine, but to us as, human beings on this earth, would be my LinkedIn account, which is just my name, Nicole Jackson, MD. You can find me on there. I don't do too much, but that's one option. And then follow me on Twitter at Nicole Jackson, MD. And that's more of an insight. I think you'll see more of me as a person. So not just, what I've been researching, not just what's been going on. I don't really talk about what's going on at work so much. But you also get to see, what I think is important in terms of, I just found this for wellness, or this was an interesting case a colleague had, and I think you can learn from this. You also just see things I think are interesting in the world and kind of my take on them, and a lot of updates for COVID, because there's a lot of misinformation out there. So try to do my part to combat that with truth. It's like the best we can do right now, just give simple truth.
That is important. That is important for us to get our information from the experts and not just see something and believe it to be the truth. So, yes. So, listener audience, please make sure you go out and follow Dr. Nicole Jackson on Twitter, on LinkedIn, so that you can stay abreast of what's happening out here in regards to COVID-19, forensic pathology. Anything else that she might be talking about, self-care, mentoring, epidemiology, public health, make sure you follow her. She has a lot of good tips and tweets that she puts out here. So thank you so much, Dr. Jackson. Our time, I could talk to you for longer, but unfortunately our time today has come to a close. I wanted to thank you for being a guest on the show.
Oh, thank you for having me. This was great. I enjoyed it a lot, and I hope it's of benefit to at least one person out there.
Absolutely. I know that it'll be, it was beneficial to me, and I know it's going to be beneficial to others because I learned a lot. So I appreciate you taking your time out of your busy day to let me interview you.
Thank you.
So thank you for tuning in and checking out this episode of Elaborate Topics with your laboratory mentor, Tywauna Wilson, and my special guest, Dr. Nicole Jackson. If you like what you heard today and want to listen to previous shows, subscribe at directimpactbroadcasting.com or your favorite podcast platform. Remember to send us an email at elaboratetopics@directimpactbroadcasting.com to learn more about the show, or if you want to be a guest on the show. So please tune in next week for another amazing episode. Until then, have a great day.
Thank you for tuning in to another episode of Elaborate Topics, where your hosts discussed relevant strategies for laboratory professionals. Please subscribe to this podcast on your favorite podcast platform and listen to us on directimpactbroadcasting.com. Stay tuned for another episode with information you can use to excel in your laboratory career.